Hi, I'm Dr. Paula Hubert and I'm a board-certified OBGYN, and I'm here to talk to you about what to do after you get that positive pregnancy test. This can be a very exciting time in your life, or it can be a very stressful time in your life, whether it was planned or unplanned. We want you to have the best experience that you can have. We're open to conversation and want this to be a wonderful experience for you. Initially, you may call to set up an appointment. You've had a positive home pregnancy test. One of our OB nurses will call you and go through all your health history and determine how soon you may need to be seen. That could be anywhere from 6 to 10 weeks, and typically that first OB appointment with either an OBGYN or one of our nurse practitioners or physician assistant will include an ultrasound for dating and viability to see if we know how far along you are, if you weren't sure of your last menstrual period or date of conception, and then to go through your health history to determine if your pregnancy will be low risk or high risk, and if there's anything else we need to focus or educate on. We usually do a physical exam. You may have your blood drawn at that appointment for routine labs, and you may have a pap smear or cervical cultures. We go through your ultrasound that you may have had that day and discuss your due date and any findings we may have. We'll talk about some of the labs you might hear out there, such as genetic screening or non-invasive prenatal testing. Everybody wants to know, can I find out the gender as soon as possible? Well, you can find that out through these tests as early as 10 weeks. These tests don't tell you everything, and your physician or nurse practitioner or PA will discuss what it is looking for and what options are available for you. If before that appointment you may have higher risks, such as a prior miscarriage or prior ectopic pregnancy, we might have you come in sooner. We would want you to call if you had any severe pelvic pain or bleeding or other concerns. In preparation for your pregnancy, you want to make sure you're eating healthy, getting enough sleep, taking a prenatal vitamin, avoiding alcohol and tobacco or other recreational drugs. Try and get healthy so that you and baby can both be healthy. We typically see you in the beginning of your pregnancy about once a month, and then around 28 weeks, which is the third trimester and next big set of labs, we start seeing you every 2 weeks, and in that last month we see you weekly and get you prepared to have that delivery. Here at Women's Health Specialists, we want your pregnancy to be a wonderful experience. We're here for you and are here to answer your questions. You can call the clinic during clinic hours, or there is an after-hours call service where someone would get back to you in the event of an emergency. Congratulations on your news and this exciting part of your life. We look forward to meeting you and going through this life-changing experience with you.